alaikum. Yo, my people, how's everyone doing? Good, lovely, lovely, lovely. I am Zach, and to my right I have...
Miriam.
What's a fun fact about yourself?
I am a student mental health nurse and work in a mental health hospital.
Sounds amazing. You work in a mental health hospital.
Yeah.
Okay, we'll delve more deeper into what that actually means. But to your right you have...
Yasmin, and I'm in my final year of uni studying education studies.
And I'm Yasser, a first year uni student and a former mental health support worker.
Oh, that sounds interesting as well.
Yeah.
And yourself?
My name is Samira. I'm in my third year of uni and I study psychology.
I'm Zayneb. I'm a photographer and a journalist.
Inshallah. And I'm Zach, and I have nothing to do with mental health. I'm just...
Vibes.
But yeah, so today's first topic, inshallah, we have is, if I can bring this up, because some people, myself being the worst of all of this, very underprepared. But today we shall be prepared. And the first topic of this podcast shall be about signs of someone suffering from mental health. Obviously, I think the best way for us to start this, obviously it being the introduction and everything, is getting to know more about what it is that every single one of us does. And I think, starting from Miriam, what do you actually do? As in, you give me a job title, but what is it that you actually do within your job title?
So I work on an acute and psychiatric intensive care unit.
What does that mean?
So that means I look after people with diagnoses such as bipolar, schizophrenia, anxiety, personality disorder, gambling addicts, you name it. A lot of people come through. It's more time people who struggle within their mental health and aren't stable at the current moment. And we give them a treatment plan, sometimes therapy, sometimes medication. But yeah, and then I study alongside it, so inshallah I will be a qualified mental health nurse in the foreseeable future. But yeah.
Sounds good. So you want to be a qualified mental health nurse?
Yeah.
And what is a qualified mental health nurse?
So...
For somebody that doesn't know, like myself.
Oh, okay. Let me explain. So I've worked in Oxford Health, NHS, for 5 years now, coming into 6. I have worked in sectors like eating disorders, personality disorder, psychosis, you name it. As a nurse, we would be looking after the patient more. So at the moment, I'm a healthcare assistant / support worker.
You're a healthcare assistant?
Yeah.
Are you working with old people?
No, mental health. So the ages range from 18 to 60.
Okay.
I work currently on a male unit. I've worked with females, but I just don't do that as much anymore. It's more males.
So what does a healthcare assistant do?
So we do vital signs, which could be blood pressures. You have one-to-ones with patients. We check up on patients either every hour, every 15 minutes, or you sit with a patient every hour, like with an eyesight, because they could be at risk of self-harm, suicide. It's people who come in and they're under section. I don't know if anyone knows, but you can be under a section 2, which is up to 28 days. You will be admitted into the hospital. A section 3, which is up to 6 months. Or a nurse can 5 to you with consent of a doctor. And that means you would be held till an assessment team come out and see you. You can get a 136, which is where police can pick you up because they have got a call about your well-being and safety. Such as like neglect. We don't realise if you neglect yourself, like you don't shower, you're living in a tent, you can be picked up because you may be deemed mentally unwell. Obviously people lack capacity at a certain age, whether that's elderly, like you said.
So your main role is working with people men between the age of 18 and 16. But what demographic would you say you work with more as of now?
I actually work with more young boys from, I would say, 18 to 30.
Interesting.
A lot of them. And actually...
So you've got a lot of stories to tell?
Yeah, basically.
Interesting. Okay. Yasmin, you said you do...
Education studies.
Education studies. Why did you study educational studies?
I've always wanted to do something with like children, like just teaching in general. So I have kind of put in my mind either teaching or nursing.
Okay.
So it's just anything to do with children because it's like a passion that I've got. So I feel like I can just use that towards anything in life in general.
So do you want to become a teacher or?
That's the thing, either a teacher or a nurse, so I've still got my final year to just decide.
Mashallah. That's good. And my brother on the right?
So yeah, I'm a first year uni student.
First year?
Yeah, so I'm gonna start next month. Inshallah.
Okay.
I'll be doing engineering, and I used to work in a mental health section where I used to be a support worker. So the people that would normally come out of the hospitals, they would come to a shared accommodation where we could like help.
Make them more independent, basically.
Yeah.
You make them independent because you're teaching them in the everyday lifestyles of what they weren't doing in the hospital. Because obviously on the hospital, you're not allowed literally anything caffeinated. They're not allowed. They're not allowed any long wires because it can actually interact with your medication. Anyways, yeah.
The next person. Sorry, I forgot your name.
Samira.
What is it that you do again? So you study psychology?
Yeah, I'm going into my third year, starting in October. So I've done 2 years of psychology at my uni.
Where did you study?
Psychology.
Where?
At University of Roehampton.
Okay.
Yeah.
Mashallah.
So, the last 2 years that I've been studying psychology, I found it very interesting. However, I haven't done any work experience in that sector. I'm thinking to do that after my third year, so I can just get my degree out of the way. Yeah.
Mashallah.
I find it very interesting, and
What got you into studying psychology in the first place?
I've always had a passion for it ever since.
Did you study for A-levels?
Yeah, I've done it on my A-levels. I haven't done it for GCSEs, but I've always wanted to do psychology ever since I was young. I've always had this idea, like, when I do get my degree and I do get my profession in psychology, I've always wanted to go back home and work there because I'm from Somalia and it is an undeveloping country in the mental health sector.
That's good, mashallah.
Yeah.
I love that.
Yeah.
And the journalist?
Journalist. What do you want to know?
What's your relationship with mental health?
With mental health? Well, I've suffered from mental health myself and I was diagnosed with something. And yeah, that's what I'd like to talk about in terms of science.
Have you spoken to, so have you done any journalism regarding mental health?
No, not at all.
Okay, so this is technically your first experience?
It is.
Interesting. You should be in this chair.
Should I?
Yeah.
Do you want to switch?
But yeah, I think that's good. A nice little
You can talk about yourself.
Myself.
Go on.
Nah, we could be here for a very long time.
Okay, keep it short and snappy then.
So I studied politics, international relations. I'm in my last year at Brunel. Mental health is an interesting topic. I don't speak much about it, but there's a reason why. And I think we'll delve deeply into it. Possibly, maybe this episode, maybe in other episodes, I don't know, we'll find out. But what's my relationship with it? I think that's the first question I need to ask it. I feel as though obviously everybody knows this as well. It's a taboo subject, and not many men especially like to speak about their feelings, quote unquote. I don't publicly, but I do with those who are close with me, and that's it. And everybody has their own way of battling with certain situations, but I know within myself the only thing that's helped me battle with anything that I've had is the deen.
So the first topic is signs of somebody suffering with mental health, and that can be shown in any way. So what may be a trigger to me may not be a trigger to anyone else in this room, but you can always take note. So earlier, obviously, I mentioned neglect. That is a sign of mental health. When you stop taking care of yourself, say you want to stay in bed, you don't want to move, you can be in a depressive state, but you can also be in a low mood, in any other such of, I don't know, whatever you have. But people don't take that. People think they've not showered for a week, they're just feeling lazy. But sometimes being lazy and not doing anything actually is a result of your mental health deteriorating.
Can I ask something? How do you know the difference between having a bad week and actually suffering with mental health?
Do you know what? I don't think nobody knows. I don't think no one could tell you though. I don't think no one qualified, no consultant psychiatrist, no one who's, do you know what I mean? I generally think it's within yourself. You would know if your week has just gone terrible or if it's a bit more. With mental health, like you said, you suffered. You have that inkling that something's not right.
Yeah.
Like you know within yourself that, do you know what I mean? This is not me. Like this is not it. I shouldn't be like this, or something's not right. I don't feel good, and it kind of leads to more signs like not eating, overeating, because people forget overeating is also an eating disorder. You can eat for a good week. You can eat 10 takeaways. People overeat their feelings. You can undereat. You can gamble. You can drink. You can do drugs. I mean, you name it, you can do, and it's always a result into mental health. But people like to shut that off. People like to also use it to attention seeking, where it's, you know, people's scapegoat is, it's not necessary for their mental health. But do you know what I mean?
Yeah.
Anything that they've.
I think that's the immediate one, isn't it? So the immediate one is obviously not doing anything.
Like you said, with the overuse of drugs and alcohol, I feel like that's one main sign, because with drugs and alcohol, I feel like that's someone's way of escaping their reality.
Yeah.
Can I just oppose that quickly?
Yeah.
Because this is what I was confused about. In terms of alcohol and drugs, nowadays it's become normalised among teenagers to just try it. And of course, drugs and alcohol are addictive. Let's not get into the science behind that. So would you not say that people use it for prolonged periods because they're addicted instead of it?
I don't think so, because I know people who actively have done drugs or do drugs, and it's a scapegoat for reality for them. They're not addicted in that sense, but they're addicted of getting out of the reality.
Addicted to the feeling.
I think they can. I think at first they would, you know, just try to get out of the reality, but then afterwards they start getting addicted.
Remember, you're running away from what you feel, and like we said, like people overeat, people overdo. Also a sign, which I think people always forget, and I don't understand. It's being very manic, because people with bipolar are manic. They can overspend. Overspending is such a big thing. They'll spend $2,000 in a day.
What if it's just a personality?
But
they. And
I say it's easy. I say it's easy to distinguish a personality from the diagnosis.
Because I spend a lot of money on unnecessary stuff, but
you might be manic for that now.
I could be, but I feel fine. But how would I be able to tell the difference between it?
Do you fluctuate? Are you just always like that? Or
Yes. I say it's easy to distinguish, but I think it's easy because I've seen people, and they'll be in the hospital and I'm like, you're not unwell anymore. Like, they're just generally a bubbly, live person. Like me, for example, I'm so loud and bubbly. I'll start smiling, start screaming in my hospital, waving at patients. People probably look at me like, are you okay? But that's just me as a person. If I was to ever be very manic, I think you are able to tell. From experience, if I've ever felt a bit not correct in myself and I feel like something's wrong, I've been able to pinpoint it, because you can tell it's a different feeling. You'll know within yourself. And if you don't know, other people around you who are close can pick up on it.
Yeah, because they can see a change in behaviour.
Yeah, they can analyse.
I feel it kind of links to distancing from family, distancing from friends, and you see them doing that, but you can't really say anything because you don't know if it's going to affect it even more.
That's a big factor as well.
Do you not think open communication is very important when it comes to mental health?
I believe it's important, but I don't think everyone does. And then I'm also a coward for saying it's important, because if I was to talk about myself, I wouldn't openly go and sit with someone.
But what if it could be a
life talking to them about my own
death
mental
situation? How would you go about it? Because you wouldn't know if someone's suffering. You can see all the signs. Is it good to ask questions or to just stand down?
I think it's good.
I think it's good. It's a good deed, especially if the person is close to you. If it's like a family member or as a friend, it's always good to regularly ask them if they're feeling alright, if they're feeling okay and stuff.
But also you have to know how to approach it as well.
I was going to say, approach is a very big thing.
Yeah.
Approach is a thing. You don't approach the right way, you will trigger someone.
Well, what's the right way?
So I worked in psychiatric intensive. So we would go and assess people in general hospitals. So they would come into A&E and say that they were seeing things, or they just felt unwell. So we'd go out and assess them. And then you also do crisis calls. So do you remember during lockdown, there was a mental health helpline that went around the whole...
Yeah.
I was part of that on the phones. So we used to pick up calls, and they initially gave us like a little script to say, but the script was awful. You could not follow the script because you're asking basic things like, are you going to kill yourself? Are you going to You can't ask someone
But
about
I think
it.
those
You can't do
questions,
that.
don't you think they're
I'd say-
standard?
I'd say on a scale of 1 to
must
10, how likely do you feel like you're going to harm yourself? You have to word it. You can't say, "Are you going to kill?" abruptly. That'll trigger someone.
Well, if someone is at that breaking point, they'll probably say yes.
No, but I've
Because
seen it.
don't people call in because they're at that point in their lives where they need help? That's their sign. By calling
I want to say
in.
yes and I want to say no.
Can you say
I want to say no, but I don't want to be offensive. But I want to say no because there are some people who just ring to banter. They will ring because they feel lonely, and they'll be like, "Oh my gosh, I'm going to do this. I'm going to do this." You will call an ambulance to the house, and they're just sat there in bed drinking a cup of tea. So it's waste of services time because you can really see the NHS is undercut with a lot of finances. Mental health is the worst. We don't have nothing, no resource. We're struggling. Waiting lists for you to get diagnosed with ADHD, even autism. Oh my god, they're over 2 years. This was prior to COVID. So imagine now with COVID, my gosh, it's going to be way more.
Wouldn't you say it's really hard to diagnose something like autism?
I don't think
the signs.
I don't think autism is hard to diagnose.
I think
It's just that
it's
you
quite
can
easy
tell.
to.
Yeah.
But I think bipolar and personality disorder gets mixed up a lot.
So what's the difference?
So personality disorder, you basically have lacked something as a child. You might have parents had a divorce. You might have suffered with some sort of
Neglect.
yeah. You know, like sexual assault or some sort of assault. It's triggered you, so you cannot maintain no relationships, no friendships, or nothing. It doesn't show up straight away, but then the more the person will grow up, they'll have a friend, not become a friend. Have a friend, not become a friend.
What's the remedy to that though?
So with personality disorder, we like to say therapy. Therapy. I worked in the therapeutic community, and we would do groups rather than one-to-ones, and you'd sit about 12 of them in. I loved it. 12 patients in, and they would have to come to terms with what they went through. So, you know, everyone's got a personality disorder.
Mm-hmm.
There's no getting out of that. Some people show it more. So, you know, say for example, Zach, you ignored me with your awful text messages, and I got so emotional and upset about it. People with personality disorder would tend to have that. They'll cling on to people very easily. You can have one conversation with them, and they we try and tell them, do not get admitted, do not get admitted. We're very thorough. You can look anywhere, and not many places like to admit them because they then would tend to get into the cycle where they're thinking they're going to get treated and babied. They're kind of like somebody looking after them.
So that's a sign.
That's a big sign, yeah. They love it. They love affection from other people. They have to be the main priority to other people. But then they also do a lot of self-harming behaviours, like a lot. Sometimes they also tend to do drastic things and impulsive things, but they're not trying to do it in the way that they're actually trying to harm themselves. They're doing it in the way to get the help, if you get what I mean.
Okay,
People with bipolar.
Yeah, that's what I was going to say.
I thought so you were going to ask.
That's mood swings.
Yes, but this is when everyone gets so confused, and I get so annoyed because I'm like, we need to clarify this properly.
It's
What
over time,
is it?
isn't it? It's not
So
every second.
you can be low and manic. You low, for example, you could be not moving, not doing nothing, not showering, not eating. It wouldn't be you seeing things like psychosis, that's schizophrenia and schizoaffective, which also kind of gets misconstrued, but I don't know how. Then you get manic all of a sudden, you start jumping, thinking going to the beach, you would be shoveling outside in the grass, overspending, talking really like fast, like that. Like they speak speedy. I thought I spoke fast. Like, you know how in Morocco we speak so quick? Yeah, they speak really fast. But the diagnosis sometimes get mixed between both because people with bipolar then tend to have other types.
Are you ever solid with your diagnosis?
So
Because the signs are
diagnose,
quite similar.
I've seen a lot of people actually have their diagnosis changed. And I've seen people and I've been like, you are not that. You are definitely not that. And then over time, if you talk to someone and be like, they're not that, they're like, yeah, you're right, they're not. We need to get changed. But it's easy because I've had people come in, they've been catatonic, which is where you don't move.
I'm changing so many words right now.
Sorry, I'm sorry. No, so you don't move basically.
Yeah.
With catatonia, you will stay stiff and you struggle to move and like maintain anything. So then basically, their diagnosis could change to bipolar, to schizophrenia as time goes by. But yeah. But we're on about signs. We're on about signs, not diagnoses. So signs of mental health. If you ever suffered, what has been a sign for you that you feel within yourself?
So, in my case, I said that I've suffered from mental health. And at that point, I was very distant. I didn't shower, I didn't leave the house, I was sitting in the darkness. But then, I hope I don't offend anyone, but it was, in my opinion, it was self-administered. I chose to stay that way, and I chose to let myself go through those things.
Yeah.
And I think that's a really important thing, because I understand how mental health is becoming really big and people are actually speaking out about it, but I feel like some people are just so comfortable with allowing themselves to feel a certain way without, one, seeking help, or without, two, just giving themselves a pep talk, and they'll just let themselves be like.
That's interesting, you know. That's last point is very interesting, because a lot, like you said, a lot of people will be offended by that, but I think people shouldn't be offended by that, because it's like, it's true though, because we see it as well. Like it's become, anything that happens, bam, I'm depressed. Anything happens,
it's self-diagnosis.
Yeah, that's it straight away.
You go on Google, you'll Google your signs, symptoms of what you're feeling, and the top thing, that's it, that's my diagnosis, I'm depressed.
I'm gonna say something, and this might sound brazy, but I'm gonna say it. Yeah.
I don't know if I want to hear James go.
I personally think that the reason why a lot of people think they suffer is because they don't they're certain, like, maybe they're not as strong as within themselves as possible.
No, but elaborate. What do you mean they're strong within themselves?
Okay.
No.
Can I finish that off? Because I totally agree. In my opinion, you should always be head over heart. It's about logic. If you allow yourself to be sad and depressed,
my heart makes me run.
Okay, I mean, each to their own, but
trying to fight it can make it worse as well.
No, not fighting it. You accept it. You
That's
acknowledge it.
That's what I want to say. People don't let themselves be sad. That's the problem. They don't let themselves be sad. If you let yourself be sad, that's how I see it. If you let yourself be sad, you feel every emotion. If you feel that emotion will go. If you don't,
I disagree with that.
Yeah, but then what if you can't feel?
No, because if you do end up feeling sad, you can get a bit carried away, and then that sadness can turn into an even greater sadness, and then you'll have more signs, and then you can become deeper depressed.
The main point that I had was I feel as though people are too quick to diagnose themselves, when I think maybe it's not that deep per se. And I think that as long as you have a healthy coping mechanism with what you're feeling, we were saying this off camera, and I was saying maybe for some people it might be playing football, it might be going for a run, or it might be something where it releases those toxins and endorphins and stuff like that. Like, for the only thing I'd say is for myself, my main thing is running, because the feeling that you get after is there's no feeling that matches it. Especially when your heart rate goes to like stupid amount, like 196 beats per minute, it's like that. And then the minute you're back to resting heart rate, you get a runner's high, and that runner's high lasts longer than anything else that you could take or do or whatever, and you feel good within yourself. The second thing is diet. What you're eating, what you're putting inside your body is what you feel, and they say you are what you eat, mate. So if you put good things in your body, then you're gonna feel positive. Sometimes you could do both, eat well and exercise, and still feel like there's something missing. And this is where I think the third thing that I was going to talk about is, and that's dhikr. And without dhikr, that it's like an equation. You do physical exercise plus eating well.
Anyway, what dhikr means to people who don't know what it means.
So it's how do I say it in English? It's sending salutations upon either the Prophet or Allah Azza wa Jal. And So this can be in forms of, it's just like being mindfulness of God, innit? And being grateful and stuff like that. And it's so cliche, but until you try it, you won't know. That's the only thing I say. Until you try it, you won't know. And like I said, innit? For me, is if those 3 different variables are met, I think your mental health might be a bit better. Another one could be, for example, myself as well. I can't be in one position for a long time. So if I'm here if I'm in this country for longer than a month and a half or 3 months, I'm bored. Man needs to leave, innit? So I have to leave, go away, do whatever, see the world, come back, and I'm a lot better.
Okay.
Because there's a big difference between actually like, you know, having being mildly depressed and like having anxiety to actually having a disorder, anxiety disorder, depression disorder, where there's an imbalance of chemicals in the brain. And we are encouraged in Islam to actually treat ourselves because in the hadith, our Prophet peace be upon him said, there is no disease that Allah has created except that He has also created its cure. That's encouraging us to get this cure, so it could be speak to a doctor, get medication as well. So yeah, there's a big difference where if they try their coping mechanisms and it's not working out still, I think it's time to speak to a doctor. And actually
Sure. Then there's something wrong.
Yeah.
That's what I'm saying. But I'm saying self-diagnosis is a mad thing.
Yeah.
I was saying social withdrawal. So that could be when someone decides to be less social, going out less, being indoors more often, not being on their phone, not speaking to their friends all the time. You know how like you would just call like your friends here and there? They'll be less social in that sense, and I feel like that's one sign that someone's suffering from mental health.
How can you tell the difference between that and it being growth or a personality change and you just want your own time and your own space?
If it's your friend or something, then you would know, wouldn't you?
No, but
you
not everyone knows you. People lie.
Exactly.
People are liars.
If you have some sort of understanding of a person, you should know
That's what I'm
what
gonna
type
say.
of how
If you're
social
close.
they are.
So I would hope to
Yeah.
God my dad knows if something was wrong with me, and you know my daddy would clock straight away if something was
Yeah.
wrong.
Like if it's like a parent.
I think parents just have that parental instinct where they know
But
something's wrong with their child.
Yeah, you're right, because I don't know. Some people could
Do you
know.
disagree with it?
Nah,
Nah,
I don't feel
So you're
always.
saying
I
that
don't
if your
feel
dad
always.
wouldn't
My dad's my king. So my dad, I would hope to God knows, but he's also worked in mental health. So he's got a good overview. But I don't think I know people who will feel like the world is against them and they're so sad, and they'll reach out to me because they think I'm a professional, but I'm not, I swear. But not everyone talks to their parents, or their parents wouldn't clock. Do you know how many people I know? Yeah,
The ones
that's what I'm
who
saying.
clock.
Yeah, man, I was going through a bad time as
What
well.
signs were you showing?
Mine was just laying in bed, as soon as I get back from work, just laying
Did they
in bed.
say that
staying
you're
in bed.
lazy?
Yeah, they just say that.
You know, it's like
And what
what
would
would
they
they
advise
say?
you to do?
Just go out. Just go out. Why are you not going out? Because before I'd play football.
So
a
they
lot.
didn't speak
I'd
to
be
you
doing,
about it?
I'd be doing boxing and stuff, but after that, there was just one time, a period like for 6 months probably, just laying in the bed. As soon as I get back from work, just laying in bed.
6
That's all I
months?
did. All I did was lay in bed, and my friends wouldn't message them at all. I stopped speaking to them for ages.
Did no one realise that something was...
Nah,
Oh.
no one even asked if I was okay.
Me, yeah.
Anyway, I think that's the end of the episode. Jazakallah khair. Thank you very much. Guys, you've all been amazing.